English for medics. Dive into surgical procedures. Hello everyone and welcome to our next lesson in the series of English for medics. Today, we're going to tackle a crucial and often complex area of medical English: surgical procedures. This knowledge will help you understand, discuss, and explain these procedures accurately and professionally. Before we dive into specific surgical procedures, it's crucial to grasp some common surgical terminology. Surgery. This is a general term referring to a medical procedure that involves opening the body to diagnose, treat, or prevent an illness. Procedure. This term is often used interchangeably with surgery. However, not all medical procedures are surgeries. A procedure could be something non-invasive, like an MRI scan. Invasive. This term is used to describe a procedure that involves entering the body, often by cutting or puncturing the skin. Non-invasive. This term describes medical procedures that do not involve entering the body or breaking the skin. There are numerous types of surgical procedures, but here are some of the most common ones. Biopsy. This procedure involves removing a small piece of tissue for examination, typically to diagnose diseases. Laparoscopy. This is a type of surgery done through one or more small incisions, using a tube called a laparoscope. Mastectomy. This is the surgical removal of one or both breasts, typically done to treat breast cancer. Angioplasty. This procedure involves the use of a balloon to widen narrowed or obstructed blood vessels. Before and after a surgical procedure, there are specific terms we use to describe the patient's status and the tasks performed by medical professionals. Pre-operative. This term refers to the period before a surgical procedure. This is when pre-op checklists are completed and the patient is prepared for surgery. Post-operative. This refers to the period after a surgical procedure. The patient is often in recovery during this period. Discharge. This term refers to when the patient is released from the hospital after a surgical procedure. A discharge summary, which includes details about the patient's stay and future care, is typically prepared. That's it for today's lesson on surgical procedures. I hope this has given you a good introduction to the vocabulary used in this field. Remember, learning these terms is not only about communicating effectively, but it also contributes to better patient care. Keep practicing, and I'll see you in our next video. Until then, keep learning, and stay curious.